you have a full-time job, you probably also have health insurance, and part of your paycheck may even go to pay the premiums. Having that coverage is so important, especially if you have a medical emergency.
That's what it's there for. At least that's what we thought, right? But customers of Blue Cross Blue Shield of Tennessee say the company refuses to cover an important medical service, and they tell consumer investigator Jennifer Kraus that's leaving them with big bills they have no way to pay.
When there's a medical emergency,
I felt like something was wrong. I felt like I was going to have to call 911.
minutes can mean the difference between life and death.
Made it about halfway down the stairs, and that's when I blacked out.
After Rob Shelton had a stroke at his home in Nolensville, paramedics raced him to the nearest hospital, Stonecrest in Smyrna, where doctors quickly determined he needed the kind of care they couldn't provide. They wanted to move him to Skyline Medical Center, some 25 miles away, which can take more than half an hour under the best of conditions. So doctors called Air-Evac, a medical air transport company with helicopters staffed and equipped like an ICU.
There really wasn't a choice as far as the flight. It wasn't, hey, you can have a flight, you can have an ambulance, you can drive him yourself. It was, he could die.
We're taking him.
While Air-Evac is an in-network provider and the trip should have been covered under Shelton's policy with Blue Cross Blue Shield of Tennessee, he was billed for the entire amount.
It was $51,000.
$51,000?
$51,000. I thought, how am I going to pay this?
For Steve Hedges,
I was like, hey, call an ambulance.
It was all the symptoms of a heart attack. The closest hospital was just a mile away in Benton County, but the paramedic who evaluated Hedges thought it would be better to fly him directly by Air-Evac to St. Thomas West in Nashville. This was not your decision.
No, this was the EMT saying, you got to do this, you know. I'm not a medical professional, but he was, and I'm going to listen to him.
Blue Cross Blue Shield of Tennessee denied both Steve Hedges' claim and Rob Shelton's because the insurance company said the flights were medically unnecessary. Hedges was stuck with a bill for $65,000.
I'm like, oh my God.
Should Blue Cross Blue Shield be paying for this kind of service?
Yes. It's part of the system of emergency care.
Dr. Melissa Costello is an emergency room physician and national medical director for Global Medical Response, the parent company of Air-Evac.
Are they turning down trips that were actually medically necessary?
Yes. And they are turning down trips that a year or 2 years ago they paid.
So why the change? Well, early last year, the No Surprises Act took effect, designed to protect patients from being charged extra when they go out of network. But that same law allows insurance companies to refuse to pay for in-network services they deem to be medically unnecessary. And according to Air-Evac, no one is using the medical necessity clause to deny claims more than Blue Cross Blue Shield of Tennessee.
It's a real kick in the teeth. There's no doubt about that. You have insurance and you pay for your insurance to make sure you're covered by these things. And you expect that your insurance company will cover it.
Blue Cross Blue Shield declined our request for an interview, but said in a recently published article they are trying to lower their members' costs. And they maintain our process for covering air ambulance services is similar to others. But that's not true, according to Air-Evac's parent company, whose data shows Blue Cross Blue Shield of Tennessee last year denied substantially more claims than any of these other insurers. In fact, more than United Healthcare, Blue Cross of Oklahoma, and Blue Cross of California combined.
It's frustrating.
Costello says the insurance company is discriminating against people who live in rural Tennessee, where more and more hospitals are either closing or eliminating services.
Blue Cross Blue Shield is creating a situation where they are comfortable saying that if you live in rural Tennessee, you should have a different standard of care. You're not entitled to the care that we get in Nashville and Chattanooga and Knoxville because you live far away.
So I got about halfway down this flight of stairs, so maybe to the 10th step.
Rob Shelton, meanwhile, believes he wouldn't be here today if he hadn't been flown and gotten the care at Skyline that he needed. And he can't believe Blue Cross Blue Shield doesn't agree.
What do you think they're making their decision based on?
Money. Plain and simple.
Now, since we interviewed Rob Shelton and reached out to Blue Cross Blue Shield, the company reversed course and agreed to cover Shelton's bill. Steve Hedges, though, is still waiting.
And he's been waiting a while, right?
Yeah, both men, in fact, had their medical emergencies early last year. So that means they've been dealing with this for more than a year, more than a year and a half, as they've gone back and forth with the insurance company, trying to fight this bill. I'm told, though, that's pretty standard, though stressful, as you might imagine, as they're trying to get this resolved and have this huge bill hanging over their head with their name on it.
Which is terrible for their health, by the way.
Doesn't help with the recovery.
Sure doesn't.